My name is Cara Connor and I am the team leader for Primary Care Mental Health in Falkirk. What we do in Primary Care Mental Health, we work with patients with mild to moderate mental health difficulties. So that could be anything from stress, low mood, depression, anxiety, bereavements. We speak to people with postnatal depression. We speak to people who have panic attacks, anxiety. We speak to people who are dealing with crisis or work-related stress as well. We also speak to people who have suicidal thoughts and who might be self-harming actively or who may be trying to not self-harm. From that, we would just take a wee brief history with the person. What's going on just now? Has this happened before? Have you ever felt this way at all in the past? Or had any emotions like this? Have you had any experience? Because some people, this is their very first experience of anything mental health related and it's really scary. We would maybe look at what the right kind of treatment plan would be for them. So we might offer anything from one session, because one might be all that person needs. They've talked it through and they feel better. We would be looking at goal setting and planning. We might be looking at illness education. We might be looking at a session on relaxation and breathing. We might offer people referral into online courses that they can do in their own time as well, because that might suit people's lives better. We also might have other professionals involved, so it could be health visitors involved. We might work quite closely with them and have a chat. We might work with our colleagues in ESP, so the extended scope physios, because someone might have chronic pain, which really affects their mental health. We might even work with the practice nurses, because someone's got really high blood pressure, and then actually that person starts talking to the practice nurse and it turns out they've got really highly stress around them. They've maybe got a really stressful environment, life's maybe really stressful, a lot of anxiety. So the practice nurse might say, would you see this patient? Because I think it might be helpful. I've done a piece of work with one of the practice nurses where I worked previously in primary care. Such a good joined up piece of work in that the woman didn't even need to go on to the medication that she was going to be started on for high blood pressure. She didn't even need to start it because her blood pressure came down.